Good evening, everyone. And my name is Monica Amandas, head nurse at NatuVitro. And welcome to my IVF Answers by the European Fertility Society. Thank you very much to my IVF Answer to giving me the chance to present this presentation with you today regarding a very common, one of the most common treatments in the assisted reproduction field, which is IVF. I'm going to explain you a little more about our clinic, NatuVitro, fertility clinic based in Spain, in Barcelona. I'm going to show you the presentation of today. So I'm going to introduce a little myself as I see that there are some people joining us, and so I can introduce a little myself so you can get to know me a little better before starting with this. I am an Italian nurse, expert in assisted reproduction and research, with over 10 years of experience in the assisted reproduction field. I am head nurse at NatuVitro, and besides my work in the clinic, I am also involved in research projects as professor of patient-centered care and in different projects of the Spanish Fertility Society. My main focus is patient-centered care and fertility education. I am very, very happy of being with you today and to talk about this treatment that involves so many aspects. It's not just a treatment. There is so much more to explore today. So I want you to know that this event is totally recorded. So once my IVF Answers charged this event in the platform and the YouTube channel, you can share the video with anyone, and you can see the recording after the presentation. So let's dive into the topic of today. And I also want to take the chance to explain you a little more about NatuVitro. So IVF, we can consider it more than a treatment. Is a deeply personal decision for those who have to go through this treatment. And at NatuVitro, we know that it is a highly effective medical treatment for overcome infertility. It is also a deeply personal and emotional journey, and often arrives after years and years trying to conceive. It is a process that involves advanced science, but also for you, patience and resilience. And sometimes can be the best medical solution, even if it requires multiple steps sometimes or multiple cycles. And it is a decision that can shape your life plans and your vision, ideal vision of building a family. Because we normally, when we think about starting a family, we don't think about IVF. Of course, we think it's there is an easier way to arrive to that. So our role is to guide and support you through every stage of the IVF treatment at NatuVitro. So today we're going to see together what the treatment involves, step by step, how we care for you throughout your journey, what costs you have to expect from this treatment, and how the treatment is structured in NatuVitro, from the consultations to the medical treatment that you have to do, the lab procedures that we have to perform, the embryo transfer, and the freezing options that you will have after your cycle. And also how IVF can differ depending on each patient's circumstances, of course, because it depends on many, many factors like maternal age, the ovarian reserve, sperm quality, and previous medical history that you might have. So we will discuss together how we personalize every protocol to maximize your chances of success while minimizing the risks for you. And so I want to take the chance to show you a few images of our clinic, as many of you maybe will arrive after the first appointment online. I also want to take the chance to show you a little what is the atmosphere that you will feel when arriving to our facilities. And I must say that from the very first step inside, our patients tells us that it feels different at NatuVitro. And at NatuVitro, every detail has been carefully designed to reflect who we are and how we care for our patients. When you enter our space, you're welcomed by warm colors, soft lighting, gentle shapes that immediately create a sense of calm and safety. We want to avoid all the clinical coldness. We want to transmit you comfort, discretion, and a sense of respect for what you are going through, your emotional experience. And of course, this is not because we want to have, this is not about the aesthetics, it's not about interior design. This has to be an expression of how we see you and our values, personalized care, to give you the emotional presence that you need during your journey, and to create from the first moment until the last human connection. Of course, another important and absolutely important aspect is the scientific and medical excellence. And at NatuVitro, every part of your treatment is handled with maximum precision and expertise. And scientific and medical excellence are our highest priority for sure. So our laboratory is the first IVF lab in Spain, fully free of volatile organic compounds. We have the most advanced equipment, such as embryoscope incubators, IVF witness for traceability and safety of your samples, laser technology for the embryo biopsy, etc., etc. We have our in-house operating room and private recovery rooms for after the intervention with us, designed for transmit to you calm and privacy during your journey. Our team is made up of top-level fertility doctors, nurses, and coordinators, all specialized in fertility and trained in top European fertility centers. We know we have a lot of patients from outside Spain, so we are fluent in multiple languages to make the communication the most effective as possible and makes you feel at home, even if you're distant from home. And of course, we have the top-level embryologist with international expertise in the field. I mentioned that our laboratory is the first IVF lab in Spain fully free of volatile organic compounds. Something that has a huge impact on the success of IVF treatments is the air quality in the laboratory. In embryology labs, we work with embryos, as you understand, in their most delicate early stages of life. There are many factors that may affect the quality of the embryos. At this point, they are extremely sensitive to even the smallest environmental factor, including something that we call volatile organic compounds, the VOCs. Okay, so VOCs are chemicals that are released into the air from many common materials also used in constructions like glues, paints, cleaning products, or even perfumes. In most places, we don't notice them, but in an IVF lab, they can affect the stability of the culture media and potentially interfere with the embryo development. So we decided to build a 100% VOC-free laboratory. That means that during the construction of the lab, we avoided any material that could emit volatile compounds. We use a specialized hair purification system, and we selected every piece of equipment to guarantee a pure, clean environment where embryos can develop in the safest condition possible. We discussed about our clinic, what you will see with us, the place in which you will do your treatment. We talk about the medical and scientific excellence, but another very important aspect for us is that behind every treatment, there is a team, and we don't want to feel you that you're just another case. And NatuVitro, the people behind your treatment are just as important as the treatment itself. From the very first conversation that you will have by telephone or here in the clinic, you'll meet a team of professionals who are not only the best in assisted reproduction, but deeply, deeply committed to care for you as a person. Your doctors, nurses, embryologists, and medical coordinator work together to care for you as a person, not just as a patient. Our mission is to personalize your treatment and care, to listen to your needs, giving you the emotional support that you need during your journey with us, and to walk beside you through each step of the treatment. You won't feel alone. We believe that human connection is just as important as medical excellence. Moreover, in this field, that's why we take time to build trust, to offer clarity, transparency, calm, and to create an emotional space built by all these aspects that we were talking about together right now, in which you will feel supported and surrounded like you are in a family. We believe that science builds possibilities, but it's people who create safety, comfort, and care. Our mission is for you to achieve your pregnancy as soon as we can, in the easiest way possible, and ensure a smooth, positive experience during your journey with us. Said that, let's talk about IVF. IVF, in vitro fertilization, is an assisted reproductive technique in which a woman's own oocytes are collected after ovarian stimulation, fertilized in the laboratory with sperm, and the resulting embryos are transferred to the uterus. When is it that is recommended to go through an IVF treatment? IVF is indicated when pregnancy is not possible through other treatments such as time intercourse, ovulation induction, or intrauterine insemination, or when specific fertility factors are present, such as, for example, tubal factor infertility, moderate to severe male factor infertility, such as low sperm count, poor motility, abnormal morphology of the sperm, in cases of endometriosis affecting fertility, unexplained fertility after years and years of trying to get pregnant, in cases of fertility preservation, such as in cases of embryo freezing prior to medical treatment or for age-related decline, and couples with repeated failure of simpler fertility treatments, such as IUI. Also, we can suggest this kind of treatment to single women that want to have a baby or same-sex couples requiring assisted reproduction. So, how does it work, an IVF treatment step by step in NatuVitro. It all starts with a completely free first appointment with a specialist in PMA, which can be done in person. You can come to the clinic, see our facilities, know our professionals, or remotely via video if it's better for you. If you are insecure and you want to schedule a video appointment, you can do it with us. Your gynecologist, that will be the same from the first moment until the last, will advise you based on your specific needs, giving you fertility assessment, and you will discuss together the expectation that you might have, you will have of your treatment, both patients and doctor. So together we will decide what suits you best. We will perform diagnosis tests such as hormonal analysis, ultrasounds of the ovaries, of the endometrium. We will see the semen analysis and other necessary evaluation depending on your specific case. Once the exams and diagnosis have been completed, we will decide together when you want to start your treatment. We will perform a personalized treatment plan based on your age for sure, ovarian reserve, sperm quality, and your medical background. So we will start with the preparing for IVF, and we will start with medication guidance. So our nursing team explains step by step how to use your stimulation, your medication, including injections and monitoring. This can be the most scariest part for patients, to go through a treatment and to do the injections by yourself. So you have the options. Many options. If you are in Barcelona, you can take an appointment with our nursing team to see step by step how to prepare, to mix the medication, and to do your injection by yourself. Or instead, we can perform an via video appointment with our nursing department. So if you have many questions, if it's the first time that you have to go through injections or an IVF treatment, we will see each other. We will explain you step by step how you have to perform, mix the medication, prepare the medication. And as sometimes you have more medication to prepare, we can see step by step all these different medication that you have in your treatment. Instructions are clear and personalized, always, ensuring you feel confident and supported throughout your treatment. So you will have a personal medical coordinator during all your treatment with us that will guide you through every stage of the IVF cycle. The appointments, tests, and procedures can be scheduled remotely or in the clinic, depending on your needs. There are patients that prefer to do the treatment by distance because of their job or their personal life. There are patients that travel during their treatment. They come to the clinic, they do the exams, and they go back. Or there are patients that just do their treatment there, and we see every day the results that they have to give to us, to give to them the indicate to them what are the next steps for the treatment. Continuous support is available to answer questions and adjust your treatment plan if necessary. And there is a constant communication with your physician to ensure that any question that you might have, doubts, concern, or adjustment to your treatment are addressed immediately. Our role in the clinic is to make the medication process easier as possible, because we know it's very scary to do injections by ourselves, to ensure that every step is coordinated to minimize stress and maximize the success of your treatment, and to provide a dedicated point of contact for all your medical and logistical questions. So we start the treatment. And how does it work? How ovarian stimulation works in IVF? So this medication is made of hormones that they are given to stimulate our ovaries to produce, to make grow all the follicles of your ovarian reserve in just one cycle. Usually in a natural cycle, you will have just one that grows, and we do everything possible to make all the follicles grows at the same time. Ultrasounds and blood tests are performed every few days to check how the follicles are developing. We want to make sure that all the follicles are growing at the same time in the best way possible. So these controls, these ultrasounds and blood tests, make us understand if we have to adjust a little the medication to optimize egg number and the quality of the eggs that you will have in that cycle. And when follicles are mature, final injection triggers the eggs to complete maturation before the egg retrieval. So what we take care of in this phase of the cycle is that stimulation increases the number of eggs available after your cycle, your IVF cycle, improving, of course, chances of a success of the treatment. The process has to be carefully monitored and personalized for each patient, and we will have a continuous communication channel open with you, and the medical team will guide you through every step of the process. And once you're ready, we will perform the egg retrieval, the oocyte pickup. What it is the procedure to collect the mature eggs from the ovaries after the ovarian stimulation. It's performed under light sedation, so you are asleep, relaxed, and comfortable during the procedure. It's a very short procedure. It usually takes 10 to 20 minutes, and is generally not painful at all. How it works. A needle is guided through the vaginal wall to the ovaries using an ultrasound. So we will check during the procedure the follicles, and we will aspirate the follicles, the liquid, to retrieve the eggs. You may feel after the egg retrieval mild cramping or pressure, but patients go home the same day of the egg retrieval. It's a very it's not painful. It's not a painful procedure, and it's very, very quick. Once we go through the egg retrieval, our embryologists perform the insemination of the retrieved eggs within our laboratory facilities. Eggs are monitored to confirm that fertilization has occurred, and we will go through the embryo culture. The fertilized egg developed into blastocyst over 5 to 6 days in a controlled laboratory environment. We use the embryoscope incubators, which continuously monitors embryos without disturbing them during the process. Embryologists will track the growth and quality of the embryos to select the best blastocysts for the transfer. And the surplus blastocyst will be frozen for the future uses, hopefully for a second baby. So once we arrive to the blastocyst stage, we can perform your embryo transfer. It can be in the same cycle of your egg retrieval or in another cycle. You'll discuss with your doctor the best option in your specific case. The selected blastocyst is placed into the uterus using a very simple and painless procedure. The procedure is done without anesthesia normally. It takes only a few minutes. I believe it's one of the most beautiful moments in your IVF journey. It's one of the best emotional moments because there are many expectations and a lot of emotions going through that moment, and it is the most intense one, I believe. Our medical team will ensure that the procedure is comfortable and stress-free. And after the transfer, you will receive personalized instructions for the days following the procedure. You may feel some mild cramping or spotting, but this is totally normal, so you don't have to worry about it if it happens. And your medical coordinator will maintain constant communication with you after the transfer to monitor the progresses and answer any question or doubts you may have after the transfer. More or less 10 days after the transfer, you have to perform a blood test that you can do with us in our facilities or by distance, sending us the results. Blood test to see if there is the pregnancy, and if it's positive, early pregnancy monitoring is guided by your doctor, and the surplus embryos will remain safely frozen for the future cycles that you will need in case, for example, as we mentioned, of a second baby. There is another way to perform IVF, which is a very interesting and valid option. That you have to know before choosing the best option for you, which is the IVF with pre-implantation diagnosis of aneuploids, which is called commonly PGTA. This procedure is very similar to conventional IVF, but with the added step of analyzing the embryos chromosomally. Specifically, during the blastocyst stage, embryos that meet the required condition can undergo biopsy and remain vitrified until the biopsy results are obtained. Only the embryos that are determined to be chromosomally normal will be selected for transfer into the mother's uterus. So there is a selection of the previous selection of the embryos that can give a safe pregnancy and give pregnancy before choosing the best embryo. So this kind of treatment, this kind of diagnosis is typically recommended in cases of history of recurrent miscarriages, in cases of certain abnormalities in the sperm quality. When we have cases of repeated failures in vitro fertilization, in cases of hereditary genetic disease, and in case of advanced maternal age, over 38 years. And I wanted you to see the difference of the success rates in IVF when we perform conventional IVF, which is the first one that you can see in the screen, and the success rates of the IVF performing PGTA. Every case is related to age. As you can see, we have three different graphics. We will see the results of the IVF, conventional IVF for women less than 35 years old. And the success rate with couple sperm is the 61%, sperm donor 58%. But when we do conventional IVF from 35 to 39 years old, the results decrease a little. They are quite interesting as well, but there is a 45% of success when using a couple sperm and 48% when using donor sperm. And when age is higher, more than 40 years for the maternal age, the results decrease. But it is an interesting option for you to go through IVF, performing a PGTA testing in cases of higher maternal age, because as you can see, the results in couple sperm, using couple sperm or donor sperm, are higher than the cases of conventional IVF. If you can check, you can see that more than 40 years old, the chances of getting pregnant using PGTA testing is higher than conventional IVF for women less than 35 years old, because we are already selecting, as I mentioned before, we are already selecting the chromosomally normal embryos before transferring them. So this is a very good option, and you have to know this percentage before choosing the best option, depending on your age and depending on your specific case. Again, these are graphics, and you will discuss with your medical doctor the best option depending on your specific case. And these are the treatment costs at NatuVitro. We have the price. The first price is the conventional IVF, which is 5,495 euros. And you have the price of the IVF with PGTA included, which is 7,195 euros. I'm going to explain you a little more about what is included in all our IVF programs. This is something that you will find in the conventional IVF and IVF with PGTA, and I will explain you later the difference with the PGTA. You will have a personalized treatment by a gynecologist and a medical assistant specializing in assisted reproduction. IVF witness security system to guarantee traceability of the sample during the whole treatment process. Follow-up of the simulated cycle by your NatuVitro specialist. All ultrasounds and hormonal analyses performed at the NatuVitro clinic. Oocyte extraction in our operating room. Anesthesia is included as well. Preparation of the semen sample in our laboratory. ICSI or conventional fertilization of the mature oocytes obtained. The embryo culture in the latest generation time-lapse incubator until the blastocyst stage is reached. You will have one transfer included in your treatment. Pregnancy tests performed at the NatuVitro clinic, and pregnancy monitoring up to the 8th week at the NatuVitro clinic. And this is what is not included in our IVF treatment, which is the genetic test Cucarrier Plus, which is the testing that we will perform before starting the treatment to know that if there are the parents are carrier of inherited genetical diseases. Donor sperm, if it's needed, vitrification and annual maintenance of vitrified embryos, if there are additional transfer to perform, and all the medication, medical tests, and any other surveys not mentioned is not included. Medication can be an important cost during your IVF treatment. I always suggest patients to check in the pharmacy the price of the medication, because it's a cost that you have to take in account before starting your treatment, to be sure that you are aware of all the costs that you have to go through. And what is included in our IVF program with PGTA included? In your treatment plan, the cost already includes one embryo transfer, as before, but also the genetic study of the first embryo that you will transfer in that cycle. It also includes the general study of all the embryos obtained in that cycle. And what is not included in the IVF program with PGTA included is the biopsy and PGT from the second blastocyst onwards. You have to take in account that there is a cost of 420 euros per embryo. In cases of patients who have many embryos, we also offer the option from 8 embryos onward that the cost of PGT stays the same. For example, if there are 10 embryos, 15 embryos to analyze, the price will still be the same. That's of 8 embryos analyzed, which is 3,360 euros. So you have many options to reach us. You can enter on our website on natuvitro.com to directly click to make an appointment, or you can leave a message, an email to our clinic to arrange a meeting with us, or you can just call us on the click below. I also left you here in the screen the phone number. So if you want to take directly the appointment with us, you can easily call us. And the email that you can use to send us an email to arrange an appointment, which is info@natuvitro.com. We also suggest you to go through our Instagram, if you have Instagram, because we create with all our professionals a lot of very interesting content about fertility treatment, infertility, and regarding medication. We have done so much videos to explain you a little more about how to prepare every medication and tips to go through your treatment in the less painful way possible. So thank you very much for joining us today. We are happy to answer all your questions. I'm gonna see if there are questions for me. I will open right now to check if there are questions. Okay, I can see a patient that explained a little about her specific case. She's 43 years old with an AMH of 0.95. Would you recommend PRP before IVF? And is there anything else I can do to improve equality before treatment other than living healthy lifestyle? Do you have any AMH minimum for women of my age trying to conceive with own eggs? Thank you for sharing your personal situation. Normally, we suggest, I don't want to enter so much in the field of the medical advice. I will try to give you my advice as a nurse and from my experience through the cases that I've seen. But we usually tend to suggest to go through PRP cycles in cases of low ovarian reserve in women that are on their 30s or 35 or 36. We don't suggest to go through this kind of treatment, which we don't know really. The evidence is still limited, and we don't want to give false expectations to patients because it is there are many other factors, that are involved, as age, AMH that you mentioned, and the things that you're saying, that living a healthy lifestyle, it's a very important factor, but still it's a very delicate situation, with a very difficult. It's difficult for me to give you the best advice. In this case, is I'll explain you what I can do, but the best advice that I can give you is to talk with a doctor. Free appointment with us is free of charge. 1 hour appointment via video. You can discuss the best options and seeing if there is an history or IVF failures before this situation. Okay, and I cross my fingers for you that you can reach your dream to be a mother. So let's see if there is something more. There is a question for egg donation. We are in this case today. We are talking more about IVF treatment with your own eggs. Anyway, I will suggest you to reach us by email or phone call, and we will discuss better the options in case of egg donation. Let's see if there are other questions. So I take the chance to talk about other things that I didn't mention before. We have a wonderful team that speaks several languages. So if you live outside Spain and you want to do your treatment with us, I want to reassure you that it's the communication is easy. We have so many coordinators and doctors that speak fluently in English, Italian, French, and we also have translators for German, Chinese, Russian. So you have the option to personalize your treatment even if you are in another country. So we are, I see that there is another question. Where is the country? We are in Barcelona, in Spain. We work with patients from outside Spain. We usually have a lot of patients that go through their treatment by distance because it's easier for you, depending on your agenda and your job. Can be difficult to move to Barcelona for 15 days or 20 days to stay with us. So there are many options. So there are patients that directly do their treatment by distance, and other treatments are performed. We have a case of a patient in the last weeks that decided to come to the clinic to do the ultrasound. As I mentioned before, is included in the price of the treatment. So she came to Barcelona to perform the ultrasounds and the blood testing, and she went back to her home country. And she came back for the egg retrieval in the end, and the embryo transfer. So you can travel during your treatment. This is a treatment that doesn't make so big discomforts for you. So you can easily travel. It's very easy to combine with your personal life and your professional life. So yeah, you can travel during the treatment. Another way to feel safer during the procedure is also to have this option to perform the treatment by distance and talk with the nurses that we have in the clinic. So you have the chance to resolve any doubt that you might have regarding the injections. I know that this is one of the most scariest things to do when going through IVF, because normally we don't have to do injections by ourselves, and can be very, very scary at the beginning. But our wonderful team will make sure that you will feel just fine during the treatment. I suggest to the people that is very, very scared about needles to have a person next to them that can perform the injections for them, such as husband, parent, or if it's not possible, a nurse that can perform the injections for her. I'm seeing that there are no other questions, but I also know that sometimes can be a little difficult to do questions in public, and I understand it. So don't worry, we can arrange directly a meeting with the doctor, medical doctor in the clinic. I also understand that there are many personal information, and it's better to discuss personally with the doctor. There are many, many factors that involves this decision of going through an IVF treatment, many cultural factors. I see patients from every part of the world, and I know how can be different for every one of you to go through an IVF treatment and go outside your country and go back with all the cultural environment in which you are living. So this is very personal. Every case is different. We know it. We are used to it. And we want you to feel safe during the process and at ease as possible. So I want to thank again, the European Fertility Society and my IVF answer for this time that we had to talk about NatuVitro, to talk about IVF, to show you a little more how we work in Barcelona. And thank you very much for being here this late at night. Thanks again. And if you want to take an appointment, as I mentioned before, we will put on the YouTube channel and on the European Society channel the video that we share together, so you can have all the information about our clinic. Just go to the Instagram profile or the web page and just take an appointment with us. Thank you very much and good night.